Hello doctors. So now we will see all ceramic crown preparation. With emerging technology and newer techniques and materials, in today's 21st century, we need to know and cope up as well with the newer technologies. Those days are gone when we had metal ceramic crowns, we had metal crowns. Even metal ceramic crown, that is porcelain fused to metal crowns, have disadvantages that the metal display of the core comes over the ceramic. So the translucency is not there. For the anterior restorations, we need to have some translucency and natural appearance. And the appeal that patients are very much concerned about in these days is the aesthetics. So aesthetics is not achieved well with the help of porcelain fused to metal crowns. So now we are seeing all ceramic crown preparations. So for that we have come over with all ceramic crowns. Now for all ceramic crown, a doctor needs to know its preparation as well. So let's see what are the principles for all ceramic preparation. The gains in the strength, all ceramic restoration, it should have little strength because now no more metal core is there. Controlled clinical trials were made to find out whether all ceramic restoration is gonna be a good option for aesthetic regions. All ceramic crown should not be used indiscriminately to restore the posterior teeth. Marginal integrity should be maintained, whether it is all ceramic, metal fused to ceramic, everywhere marginal integrity is important. Technique sensitive, yes of course, because you need a very good lab assistance for these kind of all ceramic restorations. Now coming to the next one, there is conservation of tooth structure. We know all ceramic restoration requires more tooth preparation, around 2 mm of tooth preparation, whereas a metal ceramic restoration requires only 1.5 mm. So more tooth structure is gonna go away. Non-ideal tooth preparations not gonna take over all ceramic restoration. You need to have very much well-rounded borders and margins. Wear of opposing dentation if present, and that will give more pressure onto all ceramic, leading to fracture. Ease of fabrication, economic considerations, yes of course it is more costly. And primarily single unit, you have to and should go ahead with all ceramic restoration, mainly if it is of anterior teeth. Now this is one of my cases where we will see how it works out with. Biocompatible, it is very much biocompatible all ceramic because it is at the end of the day ceramic restoration. Aesthetic potential is more heavier because it gives over the translucency. The metal display over the ceramic is no more there. So we have more aesthetic potential. Internal characterization can be done. We can give gingival porcelains. We can give some internal characterization like marks, like some teeth. The natural teeth had some yellowish lines. If the natural teeth had some vertical fracture lines present, not fracture but lines present, those cracks can also be reciprocated in the denture. Those cracks can also be reciprocated in the all ceramic crown. We need to have talented technicians for these kind of preparation of the crowns. Preparation is in our hand, but fabrication of the all ceramic crown requires very good technical help and laboratory for that matter. Now this was my case of all ceramic crown, and the patient insisted me to have all the crowns of all ceramic. Now very nicely you can see we have reciprocated the gingiva over here because recession happened all over. If I would have not given a porcelain gingiva over here, porcelain ceramic over here, the ceramic of porcelain color, gingival color is called gingival porcelain. Now if I would not have given this, there would have been a black triangle present here. I wish I would have shown you the picture where initially I had given no gingival porcelain, there was a black triangle over here, which looks very unaesthetic. So nicely, beautifully we can see the crowns have no metal display and also a nice translucency at the incisal edge is present. Now how do we go ahead with preparation of these kind of all ceramic crown? The first and most important thing is putty index. We need not and ever not forget about the putty index because it heals up and it reveals us with two important things. One, temporization, and the other very important thing use of putty index is the preparation amount that we are going to do. The quantity of preparation that we are going to do is going to depict us with the help of putty index. when we cut it facial lingually as well as when we cut it mid-sagittally. Now depth orientation groove, very important to note that biplanar reduction reveals everywhere it is stays common. There has to be reduction in two planes because our anteriors are also humanly God made with two planes, one in the cervical end, one in the incisal end. So the depth orientation groove has to be one in the incisal, different on the cervical in two different planes. So it is called biplanar reduction. So incisal reduction with the help of diamond, that is with the help of this is a tapered fissures flat end burr diamond, not burr, diamond. With the help of that you will do the incisal reduction. You will give some depth orientation grooves even in incisal region. How much is that? For all ceramic it is everywhere 2 mm. Common everywhere 2 mm. It is not chamfer in lingual, shoulder in buccal. It is everywhere radial shoulder margin or a heavy chamfer margin. So facial reduction is done, and then we come to the incisal half reduction of the lingual side. Again you can see depth orientation grooves given. Facial reduction is complete. We can see a biplanar reduction happened over here. Cingulum area is reduced with the help of the lingual reduction, that is a wheel, with the help of a wheel or a flame shaped burr. Like this kind of burr is also available, flame shaped. With that also you can do this lingual preparation, that is a cingulum preparation. Lingual axial reduction, again it has to be parallel with that of the cervical facial side. So that parallelism has to be maintained with the end of flat and tapered diamonds. Axial finishing is again important because where both the margin, now here there is no problem of wing preparation. Why? Because we do not have shoulder on one side, chamfer on another side. No, we have just radial shoulder everywhere. So axial finishing should be there all over equally 2 mm. Shoulder finish line, you can see everywhere there is a radial shoulder finish line with no sharp angle. This is not a sharp angle, this is a rounded angles. No bevel is required. The completed preparations will have shoulder, sorry, not shoulder here, it is mistakenly written shoulder everywhere. It is radial shoulder or heavy chamfer, vertical lingual wall which is parallel to the axial reduction facial side. You can see a very nice axial reduction over here where you can see and appreciate the margin, the heavy chamfer margin. We have a concave cingulum reduction over here as depicted by the natural teeth. We have rounded borders. None of the borders in entire preparation should have a sharp margin because it will concentrate all the force in that particular area. When it is an incising area, even people can have deep bites. Even those can give some pressure into the crowns. Now, those people who have deep bite or class 3 habit in edge-to-edge relationship of the crowns or of the teeth, in those cases, the patient will bite onto these areas, and if it is all ceramic, it will again get fractured. So, you have to keep everything rounded borders. Now, do we know that all ceramic doesn't have a metal core? Does it have any core? Yes. It has a zirconia core inside. There is a zirconia core on which there is a layering technique that we do with the help of ceramic, the porcelain. The layering is done. Instead of metal core, we here have zirconia core, or we have yttrium imposed zirconia core to give more strength to zirconia core. Also, it can be totally made up of one material, like monolithic, mainly for the posteriors. So what happens in those? It is of one block, monolithic, lithic is one block. So from one block, when the entire thing will be made, that will be called as monolithic. Those are for the posteriors. Now if this would happen for posterior all ceramic, then we should have given a functional cusp bevel as well, and other everything remains the same. So this is all about our all ceramic preparation of the tooth, where 2 mm is must, rounded borders are must, and the third most important thing is radial shoulder or a heavy chamfer is must. These are the only three things where it differs from your conventional porcelain fused to metal crown to that of all ceramic crown.